So on that note, I'll throw in my 2 cents, since I am a dentist.
Okay.
We'll talk about something that I see all the time. There's not a day that goes by where I can't see what we call periodontal gum disease, and we see it exasperated in individuals that have diabetes, and there's very unique patterns in the way that gum disease and bone loss presents itself. In essence, what periodontal gum disease is inflammation of the gum tissue spreading to the bone, causing recession, loss of bone, and eventually loss of teeth. The patterns, again, like I said, are very specific. And what I tell my patients is that gum disease affects diabetes, and diabetes affects gum disease. In fact, very often as we control gum disease, we'll see improvements in the numbers that indicate that a person has diabetes or not. So the point is that this is a complex system. Going into that, then we have tests that we do to diagnose diabetes. We hear about, I remember in high school, we would poke our fingers, and that was our first exposure to how do you diagnose, but you hear about the finger poking and all that.
Right.
I don't think you could do finger poking now, but back then, it was no big deal.
Yeah.
Just clean up the,
Yeah.
So anyway,
Yeah.
Let's talk about the tests.
So the test. So if so, just to backtrack a little bit. So if there is a risk factor, it's very key that you get yourself tested. And so there's several tests that we can do. So some of the risk factors with diabetes is family history. So here in our family, I mean, if I go back to my family life and my family. My uncle, my cousin, we're going to have a family member that has diabetes, a sibling, a mother, a grandmother. And so there's risk factor, family history.
Right.
Sedentary. We really have a very inactive life where most of our times we're behind a desk. We don't find the time to exercise. And so having gestational diabetes. So if at some point you were diagnosed with gestational diabetes, and I'll go into more detail on that.
Gestational being when you're pregnant.
So you're pregnant, you take a glucose test, your sugars are elevated, and so you've been diagnosed. And so that's a risk factor. Hispanic. If you're Hispanic, then there's huge risk factor that if you have, high blood pressure, and so we can go into metabolic syndrome. But if you have any of these risk factors and you're overweight, so then one of the tests that you can do is what we call the hemoglobin A1C.
A1C.
So the A1C is it's a test that they do. The doctor gives you a lab order, and you get it done at a lab, and they draw blood, and it's a 3-month marker. And what happens, it's these red blood cells that we have in our bodies, and it's all these glucose molecules that get attached to it. And so this cell lives for 3 months, and so therefore we shouldn't really do an A1C any sooner than less than 3 months. And so that test will give you a diagnostic of, are you do you have pre-diabetes? Do you have type 2 diabetes? So the markers for that is if your A1C is less than 5.7, then you're normal. But
so it's a kind of an average of
a
3-month period
of a 3 month.
Right.
And so it's 5.7 to 6.4 is pre-diabetes.
Pre-diabetes.
And then above 6.4 is considered type 2 diabetes.
Type 2 diabetes.
And so some people say, well, my insurance doesn't cover it, and so then I have a hard time getting that A1C. So basically, if you were to be doing a finger stick, which is another way of checking, is as long as you take the average, and it'll kind of give you an idea. So if you're above 120, chances are you are going to have type 2 diabetes. 120.
Is this fasting?
This is fasting.
Fasting.
So then, that's the other one, is where you do a finger stick with a glucometer, and you do it at fasting. And so basically it's 8 hours of not having anything to eat. Water is okay. And so you take a glucometer and you take the reading. And basically, normal is under 100 at fasting. But if we have anything above 100, let's say 105, 106, and kind of like, okay, alert, it's more like a pre-diabetes. Above 120, chances are you are going to be diagnosed with the type 2 diabetes. So we do encourage anybody that has any of these risk factors is, you know, don't be fearful, because we hear that, you know, I do have all these, I have the symptoms, I have the risk factors, but then yet I don't want to get tested.
Let's go into, this is a loaded question. Is diabetes preventable? Because in my mind, I'm thinking if I can prevent diabetes, that's the best thing to do, and not wait for the disease to take hold of me. And really, I think that's something to consider. So is it preventable?
So it is a loaded question, no doubt. But as far as it can be prevented if you are going to your doctor, if you are, you know, doing your regular visits, if you're doing lab work. Now, if your sugars are somewhat elevated, which is more of a pre-diabetes stage,
Sure.
then at that point, then it's kind of, okay, let's make some lifestyle changes.
Because that'll lead
Right,
to
because eventually
diabetes.
it'll lead to a type 2 diabetes. So most definite, at that point, this could be prevented. Now,
Sure.
we may have to look into certain areas, like maybe, you know, we got to get more active, we got to lose 5 to 10% of our body weight, you know, how managing our stress, eating healthier. So then all these things come into play, and of course, kind of taking a moment to reflect and kind of seeing, you know, how is my life, you know, how's my self-care? And at that point, then most definitely you can reverse it. Now, once you have type 2 diabetes and you've done the test and you're at a 6.5 or a 6.6 and you do get diagnosed with type 2 diabetes, diabetes can be managed and be brought down to a parameter that's more in the pre-diabetes. Even though you have the diagnostic, then it can be managed. And so it kind of goes into remission.
Right.
So perhaps not say, well, that was reversed, but it definitely managed. And it can be it could be there, and it doesn't have to get worse and then, you know, have to face all these complications.
So I think, and when we were talking about energy and insulin, one of the biggest factors has got to be diet and, in my mind, sugar consumption. So here's a pretty cool statistic, or maybe not so cool, but the average American is consuming 100 pounds of sugar. 100 pounds of sugar. That translates to roughly about 8 pounds of sugar per month.
Wow.
8 pounds of sugar. So you say 8 pounds of sugar. So when we're doing 8 pounds of sugar, think about 8 1-pound bags of sugar that are consumed every month.
Right.
Every single month.
That's a lot. I'm kind of thinking of a 5 pound of potatoes and thinking, wow, that's a lot.
Well, isn't like a bag of sugar, doesn't it come in a 1 pound? Right?
It does.
Yeah.
And just to think,
so that is sugar that is consumed. Not only that, not all sugars are equal.
Right.
Okay, they're not all equal. Our main energy sugar that we use is glucose, correct?
Right.
And this is interesting. It's our brain that uses 20 to 25% of the glucose. That's it. That's pretty neat.
Yeah. So that is actually one of the cells that it goes to. So it definitely, once we have the sugar in our bloodstream, that percentage does go to our brain and then consequently to our heart. But you're right. I mean, glucose and sugar can be used interchangeably, but you're right. Sugar is not all equal.